Metabolic ill health is now a leading cause of death in the Western world, affecting over 80% of adults. It results from poor lifestyle choices, leading to diseases like heart disease and diabetes. Improving metabolic health involves managing waist circumference, triglycerides, HDL cholesterol, blood sugar, and blood pressure through dietary changes and lifestyle adjustments. Metabolic ill health is now a leading cause of death in the Western world, surpassing traditional causes like warfare and infectious diseases. Understanding and addressing this issue is critical for improving overall health and longevity. Heart attacks can occur even in arteries that are not severely blocked, with 86% happening in such areas. This surprising statistic highlights the importance of understanding risk factors and prevention. Dietary changes, particularly reducing refined carbohydrates and incorporating healthy fats like olive oil, significantly improve metabolic health and reduce heart disease risk. Emphasizing whole foods, such as fruits, vegetables, and healthy fats, promotes overall wellness. Heart disease is a dynamic process influenced by chronic inflammation and insulin resistance, allowing for potential reduction of artery blockages. Meditation and community support can significantly alleviate stress and improve heart health. High insulin levels can lead to insulin resistance and are toxic to cells, contributing to complications such as type 2 diabetes. Chronic stress also plays a significant role in increasing the risk of developing diabetes. A nutritionist with nearly 2 decades of experience has collaborated to create a comprehensive health plan that addresses multiple aspects of wellness. This program emphasizes not only diet, but also metabolic health and overall well-being. The program includes educational content covering topics like cholesterol and statins, aiming to provide informed consent for participants. This helps demystify common health advice and promotes better decision-making. Regular webinars and community support are integral to the program, offering participants a chance to engage directly and ask questions. This interactive approach fosters a sense of community and shared knowledge. Exercise is emphasized as a critical component for improving blood pressure and overall health, with recommendations for maintaining a manageable level of physical activity. This approach balances intensity with accessibility for participants. What are the key indicators of metabolic health? Waist circumference. A larger waist circumference can indicate excess abdominal fat, which is linked to increased health risks. Blood pressure. Healthy blood pressure levels are essential for cardiovascular health. A normal reading is typically around 120/80 mmHg. Blood sugar levels. Fasting blood glucose levels should be below 100 milligrams per deciliter to indicate good metabolic health. Higher levels may suggest insulin resistance. Triglycerides. Normal triglyceride levels are below 150 milligrams per deciliter. Elevated levels can increase the risk of heart disease. HDL cholesterol, high-density lipoprotein. HDL cholesterol is the good cholesterol. Higher levels are better, with optimal levels being 60 milligrams per deciliter or higher. Monitoring these indicators can help assess and improve metabolic health. If you want more details on any specific aspect, feel free to ask. How can diet influence metabolic health? Diet plays a crucial role in influencing metabolic health through several mechanisms. Nutrient quality. A diet rich in whole foods, such as fruits, vegetables, whole grains, lean proteins, and healthy fats, provides essential nutrients that support metabolic processes and reduce inflammation. Macronutrient balance. The balance of carbohydrates, proteins, and fats can affect insulin sensitivity and energy metabolism. Diets low in refined carbohydrates and sugars can help regulate blood sugar levels. Fiber intake. High-fiber foods improve digestion, promote satiety, and help regulate blood sugar levels. They can also improve lipid profiles by reducing cholesterol levels. Caloric intake. Maintaining a healthy caloric intake is vital for weight management. Overeating can lead to overweight and obesity, which negatively impact metabolic health. Meal timing and frequency. Some research suggests that meal timing and frequency can influence metabolic rate and insulin sensitivity. Intermittent fasting has been explored for its potential benefits on metabolic health. Hydration. Drinking enough water is essential for overall health and metabolic processes. Poor hydration can lead to reduced physical performance and may impact metabolic rate. By making mindful dietary choices, individuals can significantly improve their metabolic health and reduce the risk of associated diseases. If you want more specific dietary recommendations or insights, just let me know. What role does stress play in metabolic health? Stress can significantly affect metabolic health through various physiological and behavioral mechanisms. Hormonal changes. Stress triggers the release of hormones like cortisol and adrenaline. Elevated cortisol levels can lead to increased appetite and cravings for high-calorie foods, contributing to weight gain, especially around the abdomen. Insulin resistance. Chronic stress can lead to insulin resistance, making it harder for cells to utilize glucose effectively. This can contribute to higher blood sugar levels and increase the risk of type 2 diabetes. Inflammation. Stress promotes inflammation in the body, which is associated with various metabolic disorders, including obesity and heart disease. Sleep disruption. Stress can lead to poor sleep quality or insomnia, which can negatively impact metabolic processes, increase hunger hormones, and reduce overall energy expenditure. Unhealthy coping mechanisms. Many individuals cope with stress through unhealthy behaviors such as emotional eating, reduced physical activity, or substance use, e.g., alcohol, all of which can further impair metabolic health. Impact on physical activity. High stress levels can reduce motivation to exercise, leading to a more sedentary lifestyle, which is detrimental to metabolic health. Managing stress through techniques such as mindfulness, exercise, and social support can help improve metabolic health.